Hi, my name is Connie Aquinas and you're watching the video Measurement of Strabismus Hirschberg Test. This video is the first in a series of videos regarding how we go about measuring the strabismus. So far we've discussed how to detect strabismus, but once we detect it, whether it's manifest or latent, we are then able to measure the size of that deviation. Hirschberg test is one of the simplest ways to estimate the size of the deviation. It's not the gold standard, but it gives you an estimation of the size of the eye turn. So what we use as part of Hirschberg's test is the corneal reflections. Now, as we've learned earlier, and as in the first image here, we expect the corneal reflections to be symmetrically placed in the eyes, and we can see that they're just slightly nasal to the centre in both eyes. So in the second image here, we have a temporally displaced corneal reflection, which is telling us we have a left esotropia. And the actual position of that corneal reflection tells us or gives us an estimation of the eye turn. And when that corneal reflection is sitting on the margin of the pupil, it's considered to be a 15-degree eye turn. And indeed, every 1 millimetre of displacement equates to a 7-degree eye turn. Okay, so when we're at the margin of the iris, here we have a 30-degree ET, and when we're beyond the margin of the iris, we're at a 45-degree ET. So essentially, we can utilise the margins of the pupil and the iris to guide us as to the size of the deviation. Let's have a look at a couple of photographs here of patients where we can see their corneal reflections. And here we see that the patient has a left exotropia through the displaced reflex. And what we can see is it's sitting on the margin of the pupil, and thereby we might estimate that is around 15 degrees. In this particular instance here, we have a left esotropia, and again, it's sitting on the margin, and we might estimate that that is around 15 degrees. The issue that you'll notice here is that we have different sized pupils. This patient here has a smaller pupil as compared to this patient here who has a larger pupil. And because of this, the method of assessment can only be considered an approximate, as you do have the variability of the pupil. And there are tests where we can be more accurate with the size of the deviation, which we'll discuss shortly. In terms of recording a Hirschberg test, often clinicians will indicate that they've had a look at the corneal reflections, that there is an LET according to the placement of the corneal reflection. In this instance, it would be temporally displaced, and then an estimate is indicated next to that, which is about 15 degrees. Or sometimes a clinician might write that they've observed an LET of approximately 15 degrees by corneal reflections. Okay, that brings us to the conclusion of this video. Thank you for watching.